talk about tuberculosis, or we call TB. Tuberculosis is a communicable chronic granulomatous disease caused by Mycobacterium tuberculosis. It is usually involve the lungs but may affect any organ or tissue of the body. First of all, we say, what is tuberculosis? Tuberculosis is a communicable disease. Communicable chronic granulomatous disease. Which one microorganism involved in this tuberculosis? Mycobacteria tuberculosis. It is usually involves the lungs, mostly occur in the lungs, but maybe affect any organ or tissue of the body. So that's the definitions of tuberculosis. What is the etiology of tuberculosis? There are three types of mycobacteria which are responsible for disease in man. Mycobacterium tuberculosis, the cause of most infection in humans. So first we talk about Mycobacterium tuberculosis, cause most infection in human. Mycobacterium bovis endemic in cattle, mostly occur in endemic in cattle, but rarely, very rarely, responsible for disease in human being except who use unpasteurized milk. Atypical or opportunistic mycobacteria affecting immunocompromised persons such as with AIDS. Mostly atypical, opportunistic mycobacteria affecting immunocompromised. That person who have very weak immunity, very weak immune systems. So such as with AIDS. AIDS stands for asymptomatic immune deficiency syndrome. Spread of infections. How that spread infection in humans? So direct droplet spread, indirect spread via ingested milk. Direct droplet spread. It means from person to person by inhalation of airborne bacilli that have been coughed or sneezed into the atmosphere. So that's the direct droplet spread infection. Direct droplet spread. That's this one, bacteria by airborne bacilli, which have the affected person or cough or sneeze into the atmosphere direct to the healthy person goes to and affect the person. Indirect spread via dishes, clothing, and other articles of daily use laden with bacilli. So the affected person use dishes, clothing, and other articles of daily basis that use. So that's another type of spread of infections. Ingested milk. Ingestion of contaminated milk cause infection of those type of bacilli. So there's the spread of infections. Predisposing factor. So first of all, we goes to environmental factor. Environmental factor which lure the body resistance such as malnutrition, poverty, overcrowding, unhygienic condition, alcoholism, and heavy smoking. So environmental factor, first of all, malnutrition, poor dieting, poverty, overcrowding, unhygienic conditions, alcoholism, and heavy smoking. So that's the predisposing factor of environmental factor. So what is pathological factor of mycobacterium? So in pathological factor which lure the body resistance. So for example, diabetic mellitus, steroids, chronic lung disease, lymphoma, and psychotic drugs. So that's the pathological factor of tuberculosis. Predisposing factor of tuberculosis. In pathological factor, diabetic mellitus, who have steroids chronic lung disease, lymphoma, and psychotic drugs. So, what is the types of tuberculosis? So, the types of tuberculosis is two types: primary tuberculosis, post-primary, secondary tuberculosis. So, that's the types of tuberculosis. In next lecture, we talk about types of tuberculosis. So, that's the tuberculosis definitions, etiology, spread of infections, how they spread to another persons, predisposing factor, environmental factor, and pathological factor. So thank you. And next lecture we talk about primary and secondary and post-primary tuberculosis.